So I'm Stuart Campo. I work with the UNICEF Global Innovation Centre leading on deployment, so support to our country offices in 135 countries, trying to integrate innovation into our work.
And how did the innovation program come about?
So UNICEF has been looking at innovation for almost 10 years as a strategy to improve results for children. It really all started with the idea that as mobile technology was becoming more proliferate and widely available, we might be able to connect and support communities in new and different ways.
It started in the communications department, didn't it, rather than
Correct.
in the field, as it were?
Correct. So this started in the Division of Communications in New York with a small group of people fondly referred to as the pod people, and then moved to Uganda because we realized quite quickly that we needed to have strong field results and field testing grounds, basically, to do this work responsibly.
And you're now responsible to the Office of the Chief Executive, so it's taken very seriously within the organisation.
Correct. I mean, one of the critical steps internally as an institution in terms of sort of mainstreaming innovation was the buy-in of the Office of the Executive Director, Tony Lake, who's been very supportive of the work, as well as in the establishment of both the Innovation Unit, which sits in New York and San Francisco, as well as the Global Innovation Centre, which is based here and sort of everywhere. Kampala, Nairobi, Bangkok, and soon farther afield.
And you've got 10 innovation labs, haven't you? Where are they in Africa?
So the labs are at the country level, connected always to a UNICEF country office. We currently have labs in Uganda, in Zambia, and in Tanzania, and Burundi as well. Yeah, that's the fourth one in this part of the world.
And you've got 3 streams, haven't you, of activity that you're interested in. Give me those 3 streams before we move on.
Sure. So we focus on access to information, youth engagement, and real-time information systems.
So give me 3 examples which in a sense match to those program strands.
Certainly. In the access to information space, we're looking at both hardware and software as well as content in a variety of settings. One example which sort of betrays both the early mistakes or failures we made and then the lessons we've learned along the way is the digital kiosk or digital drum. This is a combination of hardware and software as well as curated content to offer non-formal education opportunities for young people in a variety of different contexts.
And this, metaphorically, this sits in the village, doesn't it? It sits beyond where usually this...
Exactly. So we're looking at access to information not necessarily in formal structures, but in all the non-formal areas where the real learning happens.
Okay.
Yeah.
And give me a second example.
Sure. So beyond that portfolio, youth engagement is one of perhaps the most scaled areas of our work, and that manifests itself most commonly in a program called U-Report. U-Report is an idea that originated in Uganda about 4.5–5 years ago, and now exists in over 15 countries with over 1.6 million young people. Very simply, what it is a platform to connect young people through mobile technology, primarily SMS, but now Twitter and smartphone app as well, to decision makers. They participate in weekly polls, they're asked about issues that affect them, and their voices are taken seriously by the people making decisions.
And sometimes those people, like MPs in Uganda, participate in the community itself.
Exactly. So at sort of its most evolved stage, what we're hoping for is that U-Report becomes the convening platform for parliamentarians and the constituents that they represent.
So give me the real-time information example.
Sure. So UNICEF as an organization obviously works across a number of sectors. One of the most crowded sectors and thus most interesting is the health sector when it comes to mobile systems for real-time information. In Uganda, where a lot of this work started, we have a system called M-Track that has over 16,000 community health workers registered and reporting on a weekly basis about stock levels, about services being provided, and that link between community and facility.
And this includes disease surveillance, which...
Correct. So the basically weekly disease surveillance and other interactions that health workers need to have with the formal health system to provide quality services to women and children.
And obviously, in doing this kind of work, you make mistakes. What do you think the 2 key mistakes were that you've made in the 10 years of doing this?
Sure. One, and probably the most important, is not designing with the user, right? In almost every example we have of designing something in New York or even in Nairobi, sitting in our offices rather than in the field at the community level, we see that projects are ill-fit for purpose and actually can't go to scale. So the lesson there is really always designing with your users and engaging them from the beginning, sort of from concept to completion of an initiative, so that they own it and they can inform how to do this work effectively.
And what would the second mistake be that you would point to?
I think the second mistake that we've made often and that you sort of see broadly in the sector is not planning for scale from the beginning. So we have a lot of very fancy, shiny pilots that never can go beyond pilot phase, and that's largely because people don't plan to scale from the beginning. This is financial, this is sort of technology based and how flexible the program design is, as well as the strategy level. So really thinking from the beginning about how you can bring things to scale and how you can prototype in a small and tight iterative cycle with the goal of scaling in mind to do the work more effectively.
And if we were having this conversation in 5 years' time, what would be the major changes, do you think, that innovation might bring about in the kind of work you're doing?
Sure. This might be more aspirational than sort of actually projecting real thoughts into the future, but I think one big difference will be that we'll be seeing more community-driven development. By that I mean more co-creation between communities and government ministries providing services, and less involvement of organizations like UNICEF. Our goal from the beginning has been to facilitate innovation as a strategy for development. That doesn't mean maintaining space for UNICEF in that work, but really transferring the skills of how to design social interventions effectively and bring them to scale for communities and governments to do this work themselves. So I think that will be one of the key differences 5 years out, if not sooner.
And on the tech side, you were mentioning things like a couple of examples. Give me
Sure.
those examples.
So we're exploring a number of areas, including mobile financial services, identity, transport, and perhaps most excitingly, wearables, actually. We're running a challenge right now called Wearables for Good. And this is really about trying to understand how wearables might be a game changer for women and children around the world. It's not the Apple Watch, right?
Yeah.
It's the simple sensor technology that can mean the difference between vital statistics being tracked or not for the life of a newborn child. And I think we'll see a lot more integration of wearables into national service provision, as well as citizens being able to track their own well-being more effectively.
And you were also talking about drones.
Yes.
So
it's a fashionable topic, and there's been a lot of good research recently done by Harvard and other groups on how to do this work responsibly around UAVs, which is, I guess, the term we prefer to use, but looking specifically in UNICEF's work at how we can use these devices to transport blood samples, for example, to speed up the process of early infant diagnosis of HIV, looking at prototyping the use of drones for transporting small payloads and also transporting information, as well as, of course, with the exciting work of groups like Facebook and Google, providing connectivity and other services that we know are essential, but that maybe traditional methods aren't fit for purpose to do.